Obesity is more and more of a problem throughout this country and actually throughout the world. And there is a variety of complications that occur in the overweight mother, including neural tube defects, which we're going to talk about in a little while, high blood pressure, gestational diabetes. These women are also at a higher risk for having a cesarean delivery. Interestingly, a mother that's overweight, if you look in the bottom column, which is 16 to 29 BMI, the weight gain that's required in a woman that's heavy is less than a woman that's thin. So in terms of being overweight, it's important to see these women before they conceive as well and try to get them on a diet that's going to be consistent with a modest amount of weight gain during the pregnancy. I see a lot of patients in my practice. All of what we do is high-risk pregnancies, and we see a lot of women that unfortunately have recurrent pregnancy loss, which is defined as more than 3 miscarriages. Unfortunately, most of the causes of these are unknown or idiopathic, and we just can't explain why it happened. But a variety of them can be explained, either on an infectious cause or thrombophilia, as I discussed, or chromosomal. It's too much detail to go into in this talk, but there are also issues of allergic type phenomena, immunologic causes of recurrent pregnancy loss, but that's for another night. I just want to make one mention of what's called cervical insufficiency, or we used to use a term called cervical incompetence, which I think is a very pejorative term, and I think it's demeaning, and so we much prefer the term cervical insufficiency. This is a normal cervix, and if you look at the cervix, you can see how long and closed it is. It goes all the way from there to there, and then I'm going to show you a picture of a cervix that's opening up way before time, and you can see that it's much, much shorter. And in these patients, we will put a stitch in called a cerclage to prevent further pregnancy loss. And this would be limited to women who previously have had a number of pregnancy losses. As I think you're aware, excuse me, there is something called autosomal recessive conditions where either the father or the mother are carriers of a certain gene, and if they both carry the gene, and there's a list of conditions that affect Eastern European Jews, Ashkenazi Jews, and if both the mother and father carry that gene, the chances that the baby is going to have one of these devastating conditions is about 25, is exactly 25%. Also, Eastern European Jews are at a higher risk for having cystic fibrosis, but they also have the type of cystic fibrosis that is identifiable in about 97% of cases. So let's talk about the fetus now. That's sort of a smorgasbord of the type of conditions that moms can have. The fetus can have a variety of congenital malformations, which starts with a genetic background, a genetic tendency to have congenital problems, and then during the teratogenic period of development of the organs, if they're exposed to alcohol or they're exposed to medications or they're exposed to sugar and diabetes, then the fetus is at much higher risk of having a congenital anomaly. Congenital anomaly is a medical term for birth defects. And certainly, for example, congenital heart disease is related to a variety of different medications, to German measles, for example, and to diabetes. The fetus can be at risk from a variety of insults, such as infection. Chickenpox, for example, can cause birth defects, and medications and so on. Women that have twin gestation or triplet gestations, those twins or triplets are also at a higher risk for having birth defects. The babies that are at the greatest risk are babies who are born to a family who had a previous affected pregnancy, a family history of a problem with genetic conditions, and the type of condition that you might have is related to your ethnic background as well. As most of you probably know, people in my profession that do maternal fetal medicine do a lot of ultrasounds, and we're now able to diagnose the majority of congenital malformations prior to birth, although we still are not perfect at diagnosing congenital heart disease. And there's value in making this diagnosis, obviously, even if the pregnancy is continuing, in terms of where the baby should be born, preparing the mother and the family psychologically, emotionally, and medically for this, and getting the appropriate consultations. For example, one of the examples would be there are babies that are born with the intestines outside of the stomach, outside of the abdominal wall. You want that baby to be born in a place where surgery could be performed, and you want the parents to see the pediatric surgeon prior to delivery.